breast cancer and intimacy. I'm Dr. Stefanie Mikulics, and I wanted to speak a little bit on this topic. In my practice, I specialize in women's health, gynecology, and integrative practices for health. And many times, fortunately, we have women who are surviving their breast cancer, thriving and doing great, but sometimes their intimate health and their relationships are still suffering. So a lot of times at the time of the breast cancer diagnosis, women are, in menopause or close to menopause, or sometimes the treatments can induce a chemical menopause. And when this happens, it can create some changes vaginally, and this can make intimacy very, very uncomfortable or even downright painful. And so I think what women need to know and to realize is that, as with most things in life, there's not necessarily a quick fix or a one and done. So when we're looking to improve sexual health and well-being, it's important to have kind of a broad spectrum view. And so much about our intimate health is, it's complicated. It's partly physical and partly emotional and partly mental. And not to say that you're mental, but we need to address all these issues to help kind of get our relationships back online and get our bodies feeling their best. So I always recommend, some kind of personal lubricant. I think that goes a long way, because once we don't have any more estrogen, which really from a physical standpoint, that's what it's about, right? We lose our hormones, whether through natural menopause or chemotherapy-induced menopause. The hormones are really low, and there's most of the time not an option to just replenish the hormones. So we need to get creative, but there are very good integrative modalities to use, and they can be very, very effective. So a personal lubricant or moisturizer. I love this one, the Good Clean Love brand. I'm not affiliated with them, but they really are clean. And especially when we're talking about, preventing cancer, preventing chronic disease, we want to be mindful of toxic burden, and we want to keep our toxic burden low. So this is not going to increase chemicals and toxins in your system. So that's why I like this one a lot. Depending on where you are in your treatment and in your health journey, you may be a candidate for a very, very low dose vaginal hormonal regimen. And studies have shown that after about a month out of use, blood serum levels of women on the placebo group and active medication group for hormone levels were no different. So it is a very, very safe thing to do at the right time if you are open to that. For many women, there's just so much fear that it's kind of counterproductive, because fear takes hold of our amygdala and shuts down everything in the intimacy and fun department. So talk to your doctor about that one. And then the third modality I love to use is something called the Mona Lisa Touch, which is a laser designed for intimate health and vaginal rejuvenation. And this bypasses the whole hormone issue and gets right to the root of the issue, which is, lack of collagen, dryness, lack of blood flow to the tissues. And through a simple, gentle, quick laser treatment, your body is able to heal and get back online in all of those departments. So it restores the tissues to what they were premenopausally. It helps with, increasing moisture, increasing thickness and plumpness to the tissues, improving blood flow to the tissues, and all of the like. So I meet women every day, whether they are, from a medical background or not, who don't know about these options and who are struggling and quite sad, struggling in their relationships. So I hope that this helps so that you can empower yourself and learn more about these incredibly effective options that may be just right for you. All right, take care. Thank you.